Hi, Dr. Summer. I wish you and your family are safe and sound. Today, I'm going to talk about oral white lesions, and we will start our case with a 58-year-old white male who presented to his dentist with a 9-year history of widespread white lesions involving the left buccal mucosa, the left buccal vestibule and buccal gingiva, and the left lateral border of the tongue. The patient's past medical history is significant for smoking, but he stopped smoking 11 years ago. These lesions were not present when he smoked and did not appear until years after the nicotine gum use. The family history is negative for any similar lesions. The dentist instructed the patient to stop holding the nicotine gum on the left side, which he did for 6 months, but the white lesion did not show any evidence of regression. However, he reduced the number of nicotine use from 10 to 8 pieces, and that small reduction demonstrates improvement. Clinical and radiographic findings. The left side of the oral cavity was diffusely white and rough. It involved the left buccal mucosa and vestibules, left lateral tongue, and left mandibular gingiva, which means all areas where the nicotine gum was held. The lesions were white, rough to palpation, diffuse, and leathery in consistency, and they were asymptomatic, which means they were not painful or ulcerative. The dentist decided to take an incisional biopsy. Histological examination reveals a hemisected piece of soft tissue composed of keratinized surface epithelium with underlying fibrous connective tissue. The surface epithelium is covered by a thick layer of parakeratin, which is superficially infiltrated by bacterial colonies. The spinous layer is of increased thickness and shows evidence of reactive atypia in the form of cells with large nuclei. The connective tissue is infiltrated by a few lymphocytes, plasma cells, and occasional neutrophils. And here are the histological sections. So what is our differential diagnosis? It can be lichen planus, smoker keratosis, frictional keratosis, candidiasis, and white sponginovus. Let's talk about them one by one. Lichen planus is a good thinking, but this lesion is known to have a symmetrical pattern on the bilateral buccal mucosa and vestibule, and the lesion lack of striation and reticular pattern excluded. Plus, the histological sections do not support this diagnosis. What about smoker keratosis? Smoker keratosis is an essential thinking, but since the patient stopped smoking 11 years ago and the lesion did not appear until recently, plus the histological section do not support it, this is not the correct diagnosis. Candidiasis is known to be an opportunistic condition, but this patient does not have any opportunistic condition, and the lesions did not wipe out, and candidiasis is known to be diffuse, which doesn't mean that it can involve one half of the mouth. Plus, the histological sections do not support candidiasis. What about white sponginovus? White sponginovus is a childhood illness with positive family history, which is not the case for this patient. Plus, the histological sections do not support this diagnosis. So, our diagnosis is frictional keratosis. Frictional keratosis is an epithelial response to mild chronic trauma, such as chronic chewing, and the histological sections do support this diagnosis. So, what is the treatment? Based on the results of incisional biopsy, the patient was advised to completely stop the use of the nicotine gum and switch to a continuous nicotine patch. And thank you for listening.